Good morning, sir. I am Mark Edsel Villador, and I will be your student nurse for today. Sir, may I ask what is your name, please?
Christian Benedict together.
Thank you, sir. So, what is your age and your birthday, sir?
November 6, 2006, 15.
Yes. Thank you, sir. It is important to get the two identifiers of the patient to make sure that we are doing the right procedure to the right person. So, before I started interviewing the patient, I asked him to wear a examination gown to provide privacy, and I make sure that the curtains are closed, and I make sure also that I properly washed my hands and perform hand hygiene to prevent transmission of virus. Before proceeding to the examination, first we need to gather our equipments that is needed. First is the clean gloves. Next is pen light for better viewing. Stem of the spoon as a substitute to tongue blade, and gauze pad to hold the tongue of the patient later. Using all the equipments and gathering them, next is we need to explain the procedure to the patient. So, para aware po siya sa mga gagawin at hindi po siya mabigla while we are examining. So, sir, today we will going to assess your mouth, tongue, throat, and your sinuses po. Sir, would it be okay for you?
Okay.
Thank you, sir. Now, let's proceed to the examination. First, we need to examine the mouth of the patient. So, while I'm getting the subjective data for the client, for the health history, I can conclude that the patient has no signs of halitosis or bad breath, so which is a good sign. So, if ever that the patient has halitosis or bad breath, we can educate the patient so alam niya na yung gagawin next time to prevent having bad breath or mabahong hininga in a better way as a independent nursing intervention. After assessing any distinctive odor to the breath of the patient, next is we need to inspect and palpate. So, for safety purposes, we need to wear clean gloves to prevent any transmission of virus and microorganism, and also to avoid the bodily fluids to transfer from the nurse, from the patient to the nurse. In inspecting and palpating the oral mucosa of the patient, we need to make sure that our clean gloves are clean and sanitized. So layo ko.
Naka-play na yun.
Nakapalay ha? So first, we need to assess the lips of the patient. So as we can see, the lips of the patient has a brownish to pinkish color and no signs of break and cracks. That means that the patient is well hydrated and no signs of dehydration, which is good. Also the color, there are no signs of jaundice, cyanosis, or pallor. To assist the heat of the patient, we need to count the missing teeth of the patient and to identify. So as we can see, the second molar of the patient is missing on both sides in the lower teeth, and also in the upper teeth it is complete, which is a good sign also, and there is no signs of breakage or blacky color or signs of cavities, which is good, and no other yellowish color. After assessing the lips, teeth, and of the patient, next is we need to assess the buccal mucosa of the patient. So, as we can see, the buccal mucosa of the patient has no signs of lesions and crusting, so which means it is safe from any infections. Also, as we can see, the tissues of the oral buccal mucosa of the patient is pinkish and has moist texture and also no tenderness. So, after assessing the buccal mucosa of the patient, next is we need to assess the tongue of the patient. So, ask natin si sir na ilabas yung dila niya. Sir, can you move your tongue out? So, when the tongue of the patient is out, next is we need to assess for swelling and signs of lesion. So, as we can see, there are no signs of swelling and lesion in the tongue of the patient. Also, the color of the tongue is pinkish and similar to the color of the oral mucosa as general. And also the texture, it is smooth and uh, no signs of inflammation and ulceration. So next is we need to assess the movement of the tongue. Sir, can you move your tongue to the left, right, up, down? So thank you, sir. So after assessing or testing the movement of the tongue, next is we need to test the taste of the patient if he was able to identify. So what's the taste of that, sir?
Matamis.
Matamis. So it is a sugar, sir, and yes, it is sweet. So next is, so can you identify the taste, sir?
Maalat.
Yes. So as we can see, the patient has able to identify the difference between the sweet and salty. So after testing the taste of the patient, next is we need to assess the strength of the tongue. So sir, can you push my hands using your tongue? So as we can see, as I rate the strength of the tongue of the patient, I'll rate it as 5/5. So the patient has able to move my hands using his tongue. After assessing the strength of the tongue of the patient, next is we need to assess the lower part of the tongue. So, sir, can you move your tongue up? So, ayan. We need to inspect the ventral surface of the tongue. So, as we can see, the tongue is intact using the tongue thigh. And no signs of lesions as well. Thank you, sir. The Wharton stock of the patient using the gauze pad to hold the tongue of the patient and request the patient to move his tongue out and sir, pwede niyo po ba ilabas yung dila niyo? Hold using the gauze pad and check the Wharton stock of the patient. So, as we can see, there is no signs of lesions and it's also light pink in color. As we can see, the frenulum of the patient is in the middle and also there is a flow of saliva which is a normal signs for the patient. So after assessing the tongue, next is we need to assess the hard palate of the patient. So as we can see, there is no also signs of lesion and inflammation in the hard palate of the patient. And also, sir, can you move your tongue up? And also in the soft palate of the patient. As we can see earlier, the hard and soft palate of the patient has a pinkish color as same with the general color of the oral mucosa of the patient, which is normal. And next is we need to assess the uvula of the patient. Uvula is the hanging like pendant in the mouth of the patient. Sir, can you move your tongue up and down, sir? So, there are, as we can see, the uvula of the patient is in the middle and no signs of lesions and inflammation. So next we need to assess is the tonsils of the patient. As we can see, the tonsils of the patient are intact and no tender on the sides of the uvula. And if I will grade the tonsils of the patient, I'll grade it as 1 positive, which is normal because the tonsils of the patient is intact in the both sides and hindi siya nakakaharang sa airways ng patient and it can cause dyspnea to the patient. in general assessing the mouth, as we can see earlier, that the color has a pinkish color which is normal, no signs of cyanosis, jaundice, and pallor to the patient. Also, there are no presence of open lesions and also secondary lesions and ulcers. Also, it is moist, which is normal, and uh, there's no signs of dehydration for the patient. Also, as we can see earlier, that the two second molars of the patient is missing because according to the patient, it was removed when when he was 8 years old because of toothache and decayed tooth. So it is kailangan na siyang tanggalin para hindi pa siya lalong ma-infection. Other than that, the mouth of the patient is normal. So after assessing the mouth and throat of the patient and grading the tonsils, now we will proceed to the assessing, inspecting, and palpating the nose of the patient. So first, we need to see the nose palpate if it is symmetrical to each other. So as we can see, the nose of the patient is symmetrical to each other and no signs of lesions and ulceration in the outer surface of the nose. And also, as we can see, the color of the nose of the patient is similar also on the skin tone of the patient, on the facial tone of the patient. And as we can see, there is a mucus secretion because of his colds and cough. That was reported on the physical assessment. So as I said, the nose of the patient has a moist has moist texture and temperature because like I said, there is a mucus secretion that caused by the colds of the patient, and it is a watery consistency which is for viral infections. So as we can see, there is a small occlusion in the patent airways of the patient because of his mucus secretion. So as we can see, for the internal nose of the patient, there is no swelling or any ulceration and lesions that may cause infection to the patient, which is a normal signs. Also, the color of the inner surface of the nose is lighter than the external side because we all know that it is hidden from the sun, and outer surface are more exposed to sunlight. So after assessing the internal and external sides of the nose, next is we need to inspect and palpate the sinuses of the patient. Okay. Let's identify if there is any tenderness and lesions on the sinuses of the patient. So as we can see, there is no tenderness. And sir, may pain po bang nararamdaman dito? Well, so as you can see, walang nararamdaman na pain yung patient sa sinuses niya, which is a normal sign. To further test the sinuses of the patient, we need to trans-illuminate the sinuses of the patient by, sir, can you open your mouth wide po and tilt your head? So as we can see, the light goes through the inside of the mouth of the patient, which is a good sign, and no signs of pus or fluids in the sinuses of the patient. So after further assessing the nose, mouth, throat, and sinuses of the patient, now we will be considering doing the nursing diagnosis or interventions because we identified earlier that the patient has a mucus secretion in his nose. So then, after making nursing diagnosis to the patient, next is we need to refer the case of the patient to the physician for further assistance and care for the patient.